Good afternoon, and thank you for joining us today for Making Progress with Mayor Leroy Sullivan. Today, I'm happy to have a few guests here from West Ascension Hospital, and I want to put this out right quick. If I make the mistake and say Prevost Hospital, we all know it as Prevost Hospital, but the name of the hospital now is West Ascension Parish Hospital. We have Mr. Anthony Sheldon Anthony, who is the CEO of West Ascension Parish Hospital. And we have Miss Anastasia Montgomery, who is the Chief Nursing Officer at the hospital. And we have a couple other people that's here. They want to stay in the background. They don't want to be seen. They are support staff at the hospital. So thank y'all for coming and joining me today to be on Making Progress. Uh, and here in Ascension Parish, the city of Donaldsonville, we're making a lot of progress, and there's a lot that's going on at the hospital.
Yes,
I've
sir.
been back there on many occasions, and it is just truly amazing to see the transformation and all that's happening with the hospital. So, Mr. Sheldon,
Yes,
my
sir.
friend.
Yes, sir.
So,
Yes, sir.
tell me what's going on at Prevost Hospital.
Oh, well, Mr. Mayor, first of all, thank you. Thank the community for allowing us to be here this afternoon to just share in what's taking place at West Ascension Parish Hospital. And I'm going to pause and say this. This is your hospital. This is not a me thing. This is not an Anastasia thing. This is not about my nurses. This is about our patients here in the west side of the river and
Yes.
in Donaldsonville and the surrounding areas. So we are excited. We are ecstatic about the opportunities and what we are continuing to do for care. The first thing that I want to say to our patients and our residents is we value you. We are thankful, each and every one of you, for allowing us to be able to service you in your times of need. And our focus that we have in our leadership team and our medical staff is building the confidence and building the trust of the community.
Right.
And for that, Mr. Mayor, we are focused heavily on recruitment of physicians
Mm-hmm.
as well as qualified nurses to be able to take care of the residents here. We have a commitment, and the commitment is to do no harm, but also to take care of all of our patients. You know, when I mention all of our patients, I mean everybody.
Yes.
When you walk into the hospital, you are a part of the hospital because, again, this is your hospital.
Right.
So we are advancing in cardiology, advancing in wound care, looking at what teleservices is going to be about with neurology and nephrology, and how infection prevention is critical to what we have going on here in this side of the river. But also looking at the long term and how we are targeted with mental illness and
Yes.
mental
Right.
awareness,
Right.
and that's major. So looking at partnerships and bringing in those partnerships to be able to take care of our residents here and keep them here in our community. That's the biggest thing.
Right.
And the one of the greatest things, Mr. Mayor, and the community was bringing back our inpatient unit. For several years, the inpatient unit was here. It just wasn't utilized. So one of the commitments from Ms. Loretta Larberdine, who was our former director of nursing,
Yes.
she told me, she was like, look, we need to open our unit to keep our patients here. I said, Miss Loretta, you're right. So she and I, we developed a plan to make sure that we had our nurses and make sure that our hospitalists were able to round on our patients. And that's why when our patients that are in the ER and they need to stay for 24 to 48 or 72 hours, now they have comfortable space. And at any given time, you can have two, three, four patients over there, and you have a nurse that's
Okay.
there. You know, and Anastasia can tell you about some of the things that we are doing on the inpatient unit, because I'm not a nurse, but my passion is healthcare, and my passion is taking care of our residents here, right in the fair city of Donaldsonville and surrounding areas.
Right. And before Miss Anastasia say anything, uh, I just want to say this. Um, June of 2024.
Yes, sir.
My oldest sister ended up
Yes,
at
sir.
the hospital. She had had a stroke, uh, and you know, started the Prevost, the care and all, and just the concern and all for my sister. It was overwhelming.
Yes,
You
sir.
know, just to see uh, the care and all that she was being given, and the treatment and all she was getting while she was at the West Ascension
Uh-huh.
Hospital.
Mhm.
My sister, she transitioned July the 3rd of last year,
Mhm.
but it just was, it made me feel good and proud of the hospital. And
Mhm.
you would hear all of the negativity about the hospital, and oh, you don't want to go back there because this is going to happen, you're going to die. And
Mhm.
there's death at every hospital.
That's right.
I
That's
mean,
right.
it happens every day. But my sister was treated, and it was no special treatment
That's right.
because of me,
That's right.
but it was the love and the compassion and the treatment that she received. Uh, it made me proud to say that this hospital was
Mhm.
in the
Mhm.
city of
Yes,
Donaldsonville.
sir. Yes, sir.
Yeah.
And that's, I'm glad you mentioned your sister because very special,
Yeah.
very special. And I remember when they brought her in,
Yeah.
and I remember being there and being with the family. But we treat every patient like that.
Yeah.
And one of the key focus factors is um, if I would not want my mother-in-law to be a patient at
Mm-hmm.
my hospital, then guess what? I'm gonna shut this thing down.
Right.
But I am confident that if an event happens to my mother-in-law, or if an event happens to you,
Mm-hmm.
that we can bring you to the
Y'all
hospital,
better take good care of me. I'm
and we're
telling you
gonna
that
be
right
we,
now.
we're gonna take care of you. We're gonna give you the care that you deserve.
Brother, I plan on
Yes,
living.
sir.
I plan on living to be 110. So
Hey,
y'all
look.
got to work.
Oh, we gonna work. We gonna take care of you. We gonna take care of you. But
Yeah,
that, but
good.
but but Mr. Mayor, that's the commitment.
That's
You know,
right,
and
right.
and 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 when people say, the old way of Prevost, and it was a Band-Aid station.
Yes, that was the words.
That
Yeah,
was the word.
yeah,
I challenge you right now because you know we are not a Band-Aid station. We save lives every day, and the importance of a critical access hospital is to be able to provide that 24-hour care in a community, in a critical access rural community like Donaldsonville, to
right,
make sure that we maintain in our emergency department and our inpatient unit. Now, are we going to ever be able to do open heart surgeries? No. And I'm not going to lie to anyone.
mm-hmm.
That's not what we are going to
Right,
do. But what we are going to do is we're going to make sure that if you do need that open heart surgery, that we're going to be able to stabilize you, get you to a higher level of care.
right.
That way they can be able, who they do that all the time. But if I do open heart surgery, Mr. Mayor, I may have one person a year,
Yeah,
not
yeah,
even that. You know what I'm
yeah.
saying?
So
So I'm gonna make sure that I'm gonna be great at what we do here, and great at making sure that we can manage and and help with the preventative,
right.
because that's the way of making sure you have a healthy community. It's the preventative. So we're gonna be great at that,
Mm-hmm.
and that's the way that we're gonna continue to work for the community because our patients deserve it.
Yeah. Take a moment and explain critical care access hospital, because I don't think that the general public understand what that means, and there is no other critical care access hospital in what, a 25
Yes, sir.
mile
Yes,
radius.
sir. Yes, sir.
So St. Elizabeth, West East Ascension Hospital, whatever you want to call it,
Mm-hmm.
Assumption, St. James,
Mm-hmm.
Iberville, none of those hospitals are critical
Critical
care access hospitals.
Yes,
So
sir.
explain what that means.
Okay. So critical access is we are licensed for 25 beds. So that's 25 inpatient beds. Now, whether I'm using that as a swing bed or inpatient bed status, but that's what we have to have. We have to have a fully operational emergency department
Mhm.
with a fully operational ED staff that is competent and is trained, and then I have to have a provider that's in that ED at all times. Then we have to make sure that we are providing CT coverage at all times. We have to make sure that we have mammography and have to have a full service radiology department with also with labs. So making sure that we can do everything for our community here. It also matters because being in Donaldsonville and being in the community, we service a very heavy Medicare, Medicaid population. Right. So critical access was brought about um, almost 30 years ago to preserve hospitals in areas such as Donaldsonville. Mm-hmm. So when you think about rural communities, and at that time, Mr. Mayor, in the late 80s and the 90s, some of the hospitals was closing. So then the federal government said, you know what we're going to do? We're going to make sure that we are putting money into these communities to make sure that they are a safety net community, a safety net hospital, so that when we have issues or illnesses, that patients are not having to travel long distances. They can be able to have those services in their community, and that's what we have. Because if you think about it, we live in a desert, a health desert. You have Assumption, which is a rural emergency hospital. Right. Then our friends live north of us in Plaquemine, what I'm saying? They just have a rural area, but we are the critical access. When you cross the river in Gonzales at St. Elizabeth, you have an acute care. So now you can provide a little more higher services. And those are that's one of our sister facilities that if we need to send over, we will do that. Right. And if they have patients that they need to send over to us, then they will send over that we can have for a longer term on our side. That's the partnership.
Yeah. So the critical care hospital component of it is key to a community like Donaldsonville.
Yes, sir.
Where, like you said, there's so many people on Medicare, Medicaid, low income people.
Yes,
so this hospital is key to a community with the makeup of the city of Donaldsonville and the surrounding areas, because it benefits the surrounding areas as well.
Correct. And the thing with critical access is on our cost report. And our cost report is what we bill for with Medicare and Medicaid. We make sure that we are billing at the lowest rate so that we can keep those funds and keep those patients here.
Yes.
And that's the reason why we're considered to be a safety net hospital. But it also allows us to look at and go out and start recruiting and bringing specialties that the community needs. So one of the pleas that I have for the community, and I tell all of my patients each and every day, that if you need something, come talk to us.
Yeah.
We have a Medicaid office in our hospital now.
Right.
Something that a lot of places, a lot of communities don't have. So what that means if you don't have insurance and you come to the hospital, you're not going to be turned away.
Right.
You know what I'm saying? If you walk into my hospital, you're not going to be turned away.
Yeah.
And you can apply for Medicaid, and we have someone that will walk you through the steps so that when you leave, you can have that pending approval or denial letter in your hand.
Yeah.
Because we want to make sure we give that care for you.
And I think with West Ascension Parish Hospital, Prevost Hospital, even in the past, you always had that where no one was turned away from the hospital. And you spoke about it earlier about, it referred to as the Band-Aid hospital, but that never was the case. But, we have always been our own worst enemy because we say things about things in our area that is not true. And if we're going to talk bad about the community that we live in, what do we expect from others? You understand? Like people say all the time, oh, you don't want to go to Downsville. If you go to Downsville, you're going to get killed. All right. There are murders that are happening all over. But when it comes to Donaldsonville, for some reason, it always seems like it is magnified. And then we do ourselves a disjustice because we talk bad about the community that we live in. When I talk about Donaldsonville, I'm proud to say that I was born and reared here in the city of Donaldsonville. Donaldsonville is me, and I represent Donaldsonville. So we've always had great things going on. It's just that people's eyes have always been sort of blinded to what you could get,
Yeah.
and y'all have came in and improved on what we had here and made it even better. So we applaud y'all for the things that you're doing with the hospital. Like I said, I've been back there on several occasions. It's truly amazing.
Yeah.
I think what the people in this community need to understand, if you're sick, if you need to be brought to the hospital, you live here. First stop should be Prevost.
Yeah.
Okay.
Yeah.
And timing
It's
is
critical.
everything
It's
when it
everything.
comes to your health and
Yes.
illnesses, right?
Yeah.
So you may say, well, bring me across the river, bring me to Baton Rouge, bring me to New Orleans, and you may not make it
Yeah.
because you could have gotten some type of treatment and services
Yes.
here that
Yeah.
could have
We can
saved your life.
you can stabilize you here.
Right.
And that's the key. So Mr. Mayor, before I came, I started pulling some statistics, some stats that we
Yeah.
have. And what was very eye opening is within our last fiscal year,
Mhm.
we had almost 12 STEMIs that we had. We had no fatalities. Okay, we was able to provide that medication, stop,
Right.
and stabilize.
Yes.
And then we was able to send out. Now, I'm not God, and none of us are.
Right.
However, I think, if someone would not have stopped,
Mhm.
and let's say, God forbid, there's an accident on the bridge or something like that. Think about it. That's your life, you know. But you can trust your hospital now to understand that we are working for you. You know, we give all glory to God every
Mhm.
day,
Yes.
but we are thankful for God allowing us the abilities to be able to take care of our patients. And with that, we are proud because that gives us our purpose. And I just want to also let the community know that um, before I got here, um, the I know there was talk about there has to be change, you know, and I'm thankful for that. I'm thankful for you, the city council. I'm thankful for the Sunrise community clubs and everybody that brought about quality change. And when you walk into the hospital now, the first thing that you should feel is love.
Right.
And you should feel like you're a part of something greater. And that is why we have a commitment to making sure that we provide that quality care, and that I continue to be forward thinking. Because when I say, Mr. Mayor, we have a mental health problem, we have a health problem, we have a housing problem, we have an education problem. That all funnels through the social determinants of health, and that all funnels in, the hospital. So, what the hospital is going to do about it? You know what I'm saying? What the community going to do about it? That's why we are actively looking at, making sure that we can provide and bring a quality facility
Right.
here.
Yes.
And everybody wanted a new hospital. But guess what? We listened to you. Now we are looking at the work to see what type of facility that we need in Donaldsonville.
Yes.
Because Mr. Mayor, we're about to get a massive economic boom.
Right.
So I have to be ready. My staff have to be ready. We have to make sure that we are building a state of the art facility that can take on with industrial health, and making sure that we have pulmonologists here, industrial meds that's going to be here, that's going to be coming to the community to take care of our patients.
Yes.
So that's what we're doing.
So you talked about the new hospital. It's one of the things I want you to touch on. And if anybody is going on, we call it St. Patrick Street Extension. Some people call it Loop 945.
Yeah.
You're going to see the yellow chains
Yeah.
that have the area that is blocked off, and that's where the new West Ascension Hospital facility will be built, which will be uh, in connection or connected to the hospital facility that is existing now. It won't be demolishing what's there. You're going to be enhancing and building new. Am I correct?
So there are going to be some aspects of the old facility that we're not going to be able to use, but then
Okay.
they're going to be part of the new part of the hospital that we will be able to
Okay.
keep.
Good.
You know, but it's the history, and I am big on history and big on preserving history and preserving what we have here in Donaldsonville. So we're going to continue to build on that. But yes, Mr. Mayor, I am honored to say that um, the board was able to approve and purchase, and we was able to purchase another 10 acres of land. So we have a nice tract that we're going to be able to keep there. And I know a lot of people ask me, well, like Shelton, look, why can't we move the hospital? So the thing is with critical access, and I really want to share this with the community because critical access, that's a designation that we have. And if I was to move our designation 25 feet, 50 feet to the left, 25 feet to the right, then we were at jeopardy of losing that accreditation. Mm-hmm. And that would be a detriment to this community.
Right.
And I remember sitting down with our chair, Mr. Dawson, and I said, look, we are not going to do this. Mm-hmm. You hired me to make sure that I do the job of the community, and that's what we're going to do. And he was like, yes. So what can we do now? Well, we can look at keeping this facility here, expanding and building a brand new facility that is more modern, and that can withstand for the next 60, 70 years of growth that's going to be coming on this side. And we're excited about that. But I got to have a new facility, and I have to have the commitment with the community that you can be able to trust us in that new facility.
Yeah. And they deserve it.
Yeah, and then, yes, they deserve a new hospital.
One other thing, right quick. The relationship with River Parish Community Center, the West Side Training Facility that's going to be built right next to West Ascension Hospital. Explain the connection, the marriage that River Parish Training Center and Prevost Hospital will have when it comes to education and training people in the medical profession.
So right now, and I'm gonna let Anastasia jump on this. Yeah. But
she's been real quiet.
She's been quiet over there. She been want me to talk and say stuff. But right now, what we are doing, we have a medical assistant program here at West Ascension Hospital. That is Monday through Thursday. That is from 5 p.m. or 6 p.m.
It's 5
p.m. to 8 p.m.
8:30.
Where they are receiving hands-on experience now that they're going to get their medical assistant certification. So that's the first step that our partnership with River Parish looks like. Then it's looking like expanding out with education and making sure that even if they have like an LPN program, that they can be able to start being able to rotate through the hospital, because guess what? It's their hospital too.
Yep.
So we're going to be able to be side by side, in that area, and it's going to be very it's going to be a marriage. Right. You know what I'm saying, in a partnership, because they'll be able to utilize our services and we'll be able to provide the services on this side for River Parish. It's going to be fantastic because education is key to this community.
Most definitely. Okay, Miss Anastasia, you've been sitting here, and at first you said you were going to be doing all the talking.
You thought,
and then he started talking, and then can't get him to shut up, right?
That's right. That's it.
So, but we have something that's coming to the city of Donaldsonville next week, right? And so tell us about the event that's going to be happening. It says free clinic at the Lemon Memorial Center, 1100 Clay Street. So tell us about this event and what can people expect on Saturday, September the 13th here in the fair city of Donaldsonville
Yes,
when it
Right.
comes to medical help, medical assistance, medical services. Explain it to us.
Okay, so we're in partnership with the Love Impact Coalition Clinic.
Okay.
So they provide a free clinic, and we help sponsor it along with, the mayor and I think the Work Connection
Mm-hmm.
also sponsor it. So this clinic is for the community and the surrounding community. It is a free clinic. You only have to provide your name. We would like a good address because some of the services may require us to send you glasses if needed. Some of the services that's provided is vision. So it have free eye screenings. And if you need glasses, you'll be provided with new glasses and the glasses will be mailed to you. That's the importance of having a good address. The other thing is medical services. So medical services, they'll do HIV screenings, blood pressure checks. And if your blood pressure is high and you are needing dental services, they will treat you on the spot for your blood pressure to get it down so that they can provide you with those services. I've been a volunteer of this clinic when it was done in Baton Rouge, so I'm very familiar with it. The medical services, colon cancer, some education will be provided to you. And on the dental side, free cleaning, extractions, and also fillings if needed. We don't really truly have an age. They service children, adults, the elderly. The clinic is it's amazing, and I've told Mr. Shelton and others that I can sit here and explain it all day, but until you experience it, um, there is nothing else that I can say about it. We have vendors in place that will be there to provide services and allow you um, to gain some knowledge of other things that's going on around Donaldsonville and surrounding areas. We also have where they'll feed you, so they will feed volunteers. They will feed the people who come in for services. Income is not an issue. It doesn't matter if you have insurance or not. It is for everybody. So we are encouraging you to come out and to support this clinic, to get some of these services that you may need. Just one last thing, we have volunteers. And right now we're at capacity.
Mm-hmm.
The only volunteers that we need now, if we have any PAs, medical doctors, or nurse practitioners that can sign up to help us out. They can have anywhere from 4 hours to sign up at a time. So if you're interested, that portal is still open on the website, which is loveimpactcoalition.org. Okay.
So I wrote down needing volunteers. So, but you don't need me to volunteer because you're saying you already got everybody that you need. All right. So
You've been grandfathered in.
I've been grandfathered in. All right. It's truly amazing, and we're doing this show so that the people in Donaldsonville and the surrounding areas will know how important it is to come out on September the 13th. It's from 7 a.m. to 7 p.m. So that is 12 hours, a 12-hour window for you to come to get your eyes checked. If you might wake up and have a toothache or something, you may need to come in and get it checked out. All of the services will be available at the Lemon Center. And let me tell you, this wasn't something that just happened where they say, "Oh, we coming." This is something that has been planned.
Yes.
Let me tell you, they are going to use the entire Lemon Center. The whole building will be used and providing medical services to this community and the surrounding communities. When we first met, and they were saying, "Well, we're gonna need this. We're gonna need this room. We're gonna need all these rooms here." When you want it tomorrow, because I will get everything cleaned out and ready, because this is something great for our community, and this is the type of services we need, and it's an opportunity that everyone should take advantage of. when you were talking about having glasses mailed to you, so I can go there and get my eyes checked, and
That's
these
right.
here are a few years old, so
That's right.
I may be able to get me some new
Some
glasses, right?
That's
And
right.
like you said, Miss Anastasia, it doesn't matter whether you have insurance or not, you know. So like West Ascension Hospital, nobody will be turned away, correct?
Nobody
That's
will be turned
right.
away.
The only way you'll be turned away if it's a health thing,
Okay.
risk, too big of
Yeah.
a risk. That's the only way we won't be able to they won't be able to service you.
Okay.
And I just want to make one correction. It wasn't the work connection, it was Louisiana Healthcare Connections.
Yeah.
That's the other sponsor. But it starts at 7 a.m. And what I want to say is it's going to go on until we meet capacity. So we don't want you to wait till 5 o'clock to try and come get the service, because if we've seen 250 people by that time and there's a big gap, the clinic could possibly,
Shut down
end.
early, yeah.
Right. So it's up to capacity. We hoping that at least 250 people will show up for the clinic.
And I'm gonna tell y'all, they got me getting extra parking space. I've been calling people, begging and pleading to make sure that we have enough room for everyone to park. Uh, you know, even with the getting a physical exam, colon cancer screening. There's so much that's on here. Mrs. Sheldon, you talked about mental health.
Mhm.
So they have mental health
Mhm.
that's going to be available on that day as well. As far as getting educated on it. So look, I'm happy. I'm excited. This is something that is a game changer
Yes.
for our community as well. So please, let's take advantage of
Yes.
it. We've had Western St. Hospital, Prevost Hospital had health fairs in the past, and I'm sure they will continue to do that. But this is a health fair on steroids, right?
That's
It
right.
is something
That's
that
right.
is all inclusive, and we just want to make sure that you come out and take advantage of it. So please don't let September the 13th pass by you. Mark it on your calendar from 7 a.m. to 7 p.m. Don't wait, like
Don't
Ms.
wait.
Anastasia said. Come early, take advantage of it. The Lemon Memorial Center is located at 1100 Clay Street here in the city of Donaldsonville. If you don't know where the Lemon Center is, you can stop anywhere or anyone walking on the street, and they will be glad to tell you where the Lemon Memorial Center is. That's the kind of community we live in, where
Yes.
you can stop and ask someone questions for directions, and they'll be happy to assist you. So, anything else, Ms. Anastasia?
That is it.
That's it,
That's it.
my brother.
I'm all good. Yes,
Okay.
sir. Yes, sir.
Thank you for having us.
Well, it has been a pleasure to have y'all and all of the information that have been shared with this community, and I am just praying that this community take advantage of this free clinic that will be taking place on September the 13th here in the city of Donaldsonville. So, is there any like pre-registration or anything?
I was getting
No?
ready to say
Okay.
that. You do not have to register. Just show up. The first patient is seen at actually 7 o'clock. At 6:45, they're already coming into the building. They're very efficient. They follow all the guidelines for sterile processes. All of that goes on there. It is. I can't say enough about the clinic, and I think that the Donaldsonville and surrounding areas won't be disappointed. We have people that travel to come to these clinics.
Right.
It's very good care. It's medical doctors, like I say, they all board certified. That's taken care of, and we also had a few schools with nursing students coming in to help assist with the blood pressures and administering medications and everything. So I really hope that you come out and take advantage of this opportunity.
Well, again, thank y'all for coming on the show. Thank you for all of the information that y'all have given. And, remember, you can watch us on Facebook Live. It's supposed to be every Thursday at 2 o'clock that I do Facebook Live. But I'm going to tell you, with all of the other stuff that is going on in the city of Donaldsonville, the West Bank of Ascension Parish, I've been pulled in all kind of directions. And, It's exhausting,
Mm.
but it is very motivating as well to know the things that's going to be coming to the city of Donaldsonville. So just a couple of other announcements I want to make on Wednesday, September the 17th. The grandparents raising grandchildren will have what they call in Cozumel comes to Donaldsonville, and it will take place at the Study Commons, which is located at 1221 McGinnis Street, which is right behind the WAG Center. Uh, and they're bringing the cruise experience to you with a festive uh, Lido deck setup featuring delicious food, desserts, and beverages, along with the fun. They are also sharing tips on making wise choices while enjoying a good time. So mark the date down, September the 17th, from 10:30 a.m. until we might party so much it might go
Come
into
on
the
now.
night, right?
Hey.
And this is taking place
Sound
at
like
the
a good
Ascension
time,
Parish
huh?
Sheriff's Office Study Commons. Again, the address is 1221 McGinnis Street. So we'll be sharing that information with you as well. Uh, we also have started up the Donaldsonville Lions Club, and we had our first official meeting last night. This is going to truly be a great event to benefit uh, this community, surrounding communities, and we'll be looking for people to join the Lions Club. And I have three in a possible
Three
in
in
the
a
room
possible.
today. So we're going to work on that possible,
Uh-huh.
and we want to grow the Lions Club here in the city of Downsville. It's something new, and I'm truly excited. So again, thank y'all very much
Thank
for
you.
coming. Remember that I always ask that God bless you and keep you in my prayers. And remember, let's pray for one another. Let's pray for this community. Let's pray for those communities and that surround us. Let's pray for other states that are going through different types of devastation.
Yes.
And let's always remember to pray for our children, because they are our future,
Yes.
but we need to make sure that we pray and keep them covered at all times. So until the next time, God bless you and God keep you is always my prayer.